Hi everyone, my name's Gavin Sharrock. I'm from Wiley. I'm the Business Development Director at Wiley. My job is to connect Wiley's journal content with the pharma industry. So I work with societies and I work with our editorial teams, and then I work with the pharmaceutical industry and MedComms agencies to see how we can work together to provide educational initiatives that are beneficial to our readers and to our members. Today I'm going to be talking to you about using a content consumption strategy to inform your marketing and publication strategy. So how content consumption behaviours can help do that. So stepping back a little bit, I've been in publishing now for 22 years. So I remember the days where the digital world, the internet didn't exist. So back in the good old days of publishing, we didn't have content consumption behaviours. We used to print journals, we then used to post them out, they would arrive on someone's doorstep. We didn't know how they then consumed that content. We didn't know actually whether they read the journal. Pharmaceutical companies that we worked with, the MedComms agencies that we worked with, didn't need to know that. All they needed to know that there was a circulation, and we all assumed that that would be the case, that everyone would be reading that journal. It wasn't actually the case. I remember in my early days in publishing, turning up at an editor's office, and he was very proud of the fact that his journal was doing so well. But in the corner of his office, he had a pile of journals. They were still all in their cellophane wrapping. So he wasn't actually reading the journal himself. He assumed everyone else was, and it was going down well, but he wasn't partaking in that. So in the days of print, content consumption wasn't a thing. But things have moved on. And then the digital world came along, the internet world, and now things started to change. But in those early days, we made assumptions about what that content consumption behaviour would be like. So we assumed that the younger generation, that's my daughter on the left, 17 months old now, very good with an iPhone, very good with my iPhone. I very rarely get it back off her. She's the younger generation, we assumed were very savvy with interacting with content, consuming content through a digital medium. And the older generation would still be using print journals. They would still be using the old method of opening up the journal, reading the journal from cover to cover. And that's how we assumed in the early days of the internet that things were actually happening. We've since found out that that isn't the case. And actually, some of the younger generation prefer the print journal, if it still exists. Some of the older generation are very happy to be working off tablets and iPhones, and it's got nothing to do with an age split. So where are we now? This is one of the findings that we had. We did a survey within Wiley. We surveyed 1.2 million researchers and practitioners. We got across 75 different disciplines. We got a response rate of 4,000 people. That survey showed, and what we were asking is, these are members of societies, what we were asking is, what is it that you join a society for? What's the number one thing that you're looking for, or in this example, in this slide, the top 5 things. And as you can see across the silents, the boomers, the Generation X and the millennials, the number one thing that people are looking for is reading the association publication. That's what they've joined a society for. This tells us that actually peer-reviewed content is still very much at the forefront of what people are looking to get from a society, but also in their fields. That's the way that they communicate with each other. There's various other things that they're looking for as parts of being a member of a society. But in terms of content consumption, this and other surveys and other reports that we've had access to show us that actually reading that content is still very high up the agenda. It's just how they consume that content that has changed. So how they consume it, we all know now that we're moving into a digital world. So we know that physicians, we know that all of us are actually moving into a space where we're interacting online through various different ways, be it through social media, through reading articles on tablets or short form articles through various other methods, as well as reading the print journal. The print journal is not dead. We've seen this across the globe. Actually, there is still a demand for the print journal, but there is an interaction digitally as well. So this is a survey from 2012. 99% of physicians are using a desktop or a laptop now. This is from the US. But there are similar figures when you look at APAC and EMEA. 84% are using a smartphone, 54% are using a tablet. What we've seen since then is that the smartphone figure's gone up, the tablets dipped down slightly, but their interaction online is still prominent. But it's not as simple as saying, actually, some physicians read the journal in the print form and some read the journal online. What we're actually finding is that researchers, practitioners, clinicians, they live in an ecosystem. And that ecosystem where they do their work, where they interact with colleagues, has a number of different aspects to it. So there's social media interaction, there's peer-to-peer interaction, there's interaction through a conference or a congress, there's reading content, there's writing content. So there's all different ways that they interact within that ecosystem. When you look at that ecosystem, how people interact within that differs depending on who they are. So a couple of examples here. They're supposed to represent an ecologist and a surgeon. So apologies to ecologists and surgeons watching this for my crass representation of what they do. But what we actually found at Wiley when we looked at their content consumption interaction is that ecologists did things very differently to surgeons. Now this isn't a surprise, this is what you'd actually expect. But when we work with pharma companies and MedComms agencies, certainly until the very recent past, what we found is the way they interacted and the way they put their messages out didn't depend on who the community was, it depended on what their message was. So when we looked into this a bit deeper, and when you looked into the health sciences space, we found that haematologists were different to surgeons who were different to dermatologists. And how they interacted with that content and within that ecosystem was different depending on what they were looking for and what those communities were trying to achieve. So if you're putting a message into that ecosystem, it really depends on how they're going to interact with that content, about how you should increase the efficiency of that message. So we started at Wiley to do something slightly different. We've for a long time now, we've created personas for our communities. Those personas have been built around things like the age. You know, if you're a consultant, you're going to be in the latter stages of your career, you're going to have a certain amount of revenue, of income. If you're a trainee, your income's going to be a lot lower, they're going to do things very differently. And we used to create personas around those criteria. What we've started doing now is we ignore what their job title is, what their income is, what their age is. What we're now looking at is how they actually interact with content. So how do they search? What do they search for? When they receive and find content, how do they assess that content? How do they then interact with their peers around that content? How do they share that content? Because those we're finding we can create personas around behaviours rather than around who the people are. So how do we do this? The first thing we do when we look at a community, so say we were looking at haematologists, we would do a lot of desk research because there's a lot of reports, there's a lot of data that we can find within Wiley that show how haematologists, in this example, interact with content, and we can start pulling that together to see what themes there are. So the sorts of things we look at is, have we done existing studies? We work a lot with haematology societies. We find that they often survey their members or they have details on their members. So we pull all of that together. We look at studies that are across the market. Generally, when we find studies that are outside of Wiley, they generally look at physicians across a geographical region as opposed to haematologists or dermatologists, but that still can give us a guiding light. We look at keyword research, so we look at in that community what keywords are they using to search for things and whether they use long string searches or single keywords. We look a lot at Wiley online library data. I'll give you an example of the sorts of things we can pull out of that in a minute. We look at competitor publications around, instead of just the publication that we're pulling data around from Wiley Online Library. We look at how competitor publications are doing, and we do some social listening exercise. So we look at how they're engaging within social media, whether they're engaging, what platforms they use, and how they do that, and what types of things they're talking about in there. So we did a lot of desk research just to get a foundation of how that community will interact with content. This is an example of the sorts of things that we're pulling out from Wiley Online Library. Wiley Online Library is the second biggest database of STM content in the world. So we have millions of users. We have a lot of interactions across those users. So with that, excuse me, with that level of interaction, we can start pulling out trends about how people interact with content. So these are just 3 examples. They're not actually showing anything in there just as they stand alone. You need to put them within context. But the sorts of things we're looking at, if you look at the top left, that's the full text downloads by regions of a portion of our gastroenterology and hepatology content. So we're seeing where people are accessing it, and we can map that to where the content sits, so whether it's a British journal or American journal, and see if there's accesses across regions. If you look at the top right, that is the usage of cardiovascular disease specialists of cardiovascular disease content through the day. So this is mapped and it's normalized globally, so this particular graph. So this is across the globe, and it's normalized for the time, so we can see when they access content. And the thing that's interesting about this is if you look at cardiovascular diseases, if I put on top of that nursing, for example, or surgeons or something like that, you can quite often see differences. For example, whether people are interacting with content in the afternoon or in the evening, whether they interact with it through the day, the working day, or whether they do it in their downtime, so whether it's lunchtimes and evenings. That gives us an indication of what they're doing with that content and when they access it. You need to put some context around that. You need to talk to them to determine what is happening there, but it gives us a starting point. And then if you look at the bottom right, this is quite interesting. This is across all of our nursing content, all of our cardiovascular disease content across the year. You can see with cardiovascular disease, the interaction with content is fairly consistent, but with nursing, it peaks or it troughs, depending which way you're looking at it. So again, you need to put context around that. When you start talking to nurses about this, you start understanding that the spring and the autumn periods are when their conferences quite often happen. So that's when they're at the peak of their educational curiosity. That's when they're really digging in to see what's new, to see how they should learn. So if you're looking to engage with the nursing community with an educational message, you need to be tailoring it to when they're open to receive that. As opposed to cardiovascular disease, they're doing their CPD or their educational content. It would appear throughout the year in a consistent way. So once we've done this desk research, then we go out and we talk to the community. So then we start, when we say talk to the community, based on that research, we identify 15 to 25 individuals that are representative of that community. At Wiley, we would generally go out to society members to do this. And we have an interview with those people, which lasts for about half an hour, where we're just talking to them about why do they search, how do they search, what are they looking to achieve, why do they interact with content, is it just to keep up to date, is it for CPD points, is it for just educational needs, are they answering questions they've been asked, or are they just doing it because they want a general understanding? So by interviewing people, we're starting to dig into what we found in the desk research. And we're trying to understand why that community engages with the content, and specifically around the peer-reviewed content, but we also include e-learning content, B2B content, other pieces of content, but in a professional setting. So how are they interacting with content? Why are they doing it? What are they doing it for? And what do they do when they actually find the content that they're looking for? So once we've done about 15 to 25 interviews and we've done the desk research, we have a general idea of the content consumption trends across that community, hematologists, dermatologists, whoever it is. We tend to do this regionally because we do it on behalf of a pharmaceutical company or a MedComms agency who are looking to put a message into a particular community. We have on occasions done it globally, so we did it with urological surgeons, for example, which was a global survey. The trends become a little bit more broader, so they're less specific, but they can show some very interesting things. I'll talk a little bit in a minute about the sort of things that we're finding. What we do then, we take these trends, we take these insights, and we take it out to a wider community. So for haematology, if it was the UK, we would go to the British Society of Haematologists, and we would say, we'd like to validate these assumptions that we found and these initial findings across your whole user group. across your whole membership. So we would send out a survey that would have questions that would allow us to make sure that our representative set of 25 people is actually representative across the whole community. And generally we find that it is, and with the trends that we're seeing do actually cross over into the community. So we do that just to make sure that what we're finding is actually true across the whole society. So give you an example of the sorts of things that we found. So we've done this as this particular example. I can't give you the full details, but I'll give you the top line findings. We've done this with diabetes professionals, and the diabetes professionals was a UK audience. And we've done it with urological surgeons. As I said, the urological surgeons was a global audience. But there were some interesting findings that we came out against the surgeons, against the diabetologists. So what we found with the search timing, diabetologists would search through the day. So it doesn't really matter, they'd search through their working day. Quite often it would be in between patient consultations, probably because they've been asked a question in their consultation, they're checking what they've said. Surgeons didn't search through the day, they did most of their searching in the evening. Again, this is fairly obvious, you would guess, because they're not going to be interacting with content too much while they're doing surgery, you would hope. So actually they do their research, they do their education in the evening. But that again gives us an indication. If you want to communicate with surgeons and you're doing a webinar, for example, there's no point doing it in the day when they're in surgery. It's a very obvious thing to say. You want to put it in a time that they can actually have the free time to do that. Search preferences was very interesting. What we found with diabetologists is they search for long strings. So they search for a question or a phrase. Quite often surgeons were searching for clinical trial names, or they were searching for particular keywords, or even searching for their peers. So they were searching for a colleague's name. Content preferences. Surgeons are about the only group that I'm aware of that are still very happy to read an article from the start to the end. So they still interact with a whole print or online article and read it from introduction all the way from the abstract all the way through to conclusions. Most healthcare professionals that we deal with don't do that anymore. They will dip in and out of various different things. And diabetes professionals is a good example. They preferred short form articles, they preferred bullet lists, infographics, something that they could get the information they were looking for very quickly and digest it very quickly and put it into a usable format that they could then move on to the next patient with. How they evaluate the quality was another interesting thing. So back to what the surgeons were searching for, what we found with surgeons is they put a lot of weight on their peer group. So if a paper was written by someone that they knew, then they would immediately think that that was a high quality paper. So I guess it's an industry or a therapy area that is driven by big characters, big people that get very known. With the diabetes professionals, it was slightly different. They would look for institution, but they would also look for the journal. So if it was in a good journal, if it was Diabetic Medicine or one of the American Diabetes Association journals, that would qualify as a high quality journal, and that would immediately give them confidence that they were reading good quality content. The surgeons also were less likely to interact with B2B content, non-peer reviewed content. So magazine articles, that type of thing was not really on their radar. Diabetologists were very happy, as long as it was a high profile, high quality publication, they were very happy to engage with that type of content. And social media use, what we found is surgeons in the main don't really use social media. Diabetologists were more happy to, mainly through LinkedIn, some a bit of Facebook. When I say in the main with surgeons, there were a few ambassadors of social media that really had taken it to heart and really pushed it and were very active on Twitter, very active on Facebook, were really very big users, but they were outliers to the main surgery community that we were looking at. So what does all this mean? When we talk to pharma companies, when we talk to MedComms agencies and we're talking about how they're going to engage with an audience, how they're going to put their message out, what we're saying is that content strategy, the understanding of the content consumption behaviours, can really change the game. And when I say change the game, I'm talking about moving the needle slightly. because we all know that this is a very cutthroat, a very commoditized world in terms of gaining access, engagement with communities. They're communities that we're really fighting to get heard above the noise, not just from our competitors, from other messages that are trying to get in, but from all the other things that pull people's attention away, which could be Netflix, it could be Facebook, it could be their kids. So we're just trying to get in front of them with the right message. And if we can do that by putting it in the most engaging format for them at the right time when they're looking to access that content, in the right place at the right time with the right format, then we're going to stack the odds in our favour. So that's what we're seeing, and we can start seeing differences in the engagement of these communities if we can get the content strategy right. So we use content strategy to increase engagement with a community. We establish readers' needs earlier on, so that's the desk research and the interviews that we do, and then the validations. So then we can map high quality content against those needs. So we find that certain communities prefer video, for example, certain are very much wedded to print media. Haematologists, for example, still like print. So if we were going to a haematologist community, we would be suggesting that the message is put out in print as well as other digital media, but print would still work. Then we go through a process. We call this sweating the content, so that once we put out a piece of content, we see how it interacts with how the community engages with that. We see what the feedback is. We see what their view is of that. And then we use that to feed back into our findings. And then we can pivot or change for the next piece of content to make sure that it's still relevant. And if we're getting a high engagement with a webinar, then we would keep going down that path with video, or we could change. So we're continuing evolving, we're just continuing to uncover needs and changing our approach. So now when we work with MedComms agencies, with pharma companies, what we used to do was we would have a one-off project. You can do a key opinion in medicine newsletter. We'll see how it does. We'll see what your engagement is. Now we're saying what you need to do is you need to drip feed content. You need to change that message and the delivery of that message over a period of time. And we will help you look at that engagement, and we will help you evolve that message to make sure that we're getting the change in behaviour that you're actually looking for at the end of this. So what we're finding is that the content strategy extends the reach of that original content. So original content could be a phase 3 clinical trial, for example, that gets published. But then doing a content strategy to engage an audience that can take that content and evolve it over a period of time actually increases the length of time that content is being engaged with, but it also increases the engagement of that original piece of content. So we see the downloads of the original piece of content being driven up. Every time that we evolve a new piece of content, it links back to the original, so it drives those downloads. The other thing that I'd say is to provide, to engage a community, you always have to keep in mind that you've got to provide value to that community. It's not gimmicks, it's not a new way of, if we provide an infographic, it looks nice and shiny, so in that case it's going to be engaged with. It's still got to provide value. In fact, the value is more and more important, because that's, with all the pull on people's times, that's the sort of thing that the community is looking to achieve. So this is the last slide. What we're looking to do is we take the users of that community on a journey. So this is a typical example. Each user would have a different journey, so they can enter on a particular channel, which could be a print newsletter, it could be an email, it could be reading the original article, and we use that to then move them to the next piece of content and the next piece that could move from different channels based on their needs at the time and based on their educational level and what they're looking to achieve. So by doing multiple pieces of content that apply to that community, you can help the community work through to get the message, the educational message that you're trying to put through. Thank you very much.